Welcome to our 9th annual Remembering Downwinders. My name is Deb Sawyer and I am the coordinator of the Utah campaign to abolish nuclear weapons. UCAN recognizes the danger of nuclear weapons, from the mining of the uranium to the testing and to the ever-present possibility that one might go off by accident or intent. We need to stop making new nuclear weapons and work with the international community to abolish all of them. I thank each of you for coming. I thank Crystal Beakley and the University of Utah S.J. Quinney College of Law for hosting us, Nino Reyes for his beautiful flute performance, X-Mission for providing our web and list service needs, and each of our speakers. I also welcome and recognize Salt Lake County member Shireen Gorbani. Gail Blattenberger is the UCAN member who took responsibility for tonight's program. Gail Blattenberger is a professor emerita in the economics department at the University of Utah, where she taught for 30 years. She is a lifelong social activist relating on issues relating to peace, poverty, and the environment. She considers herself a foot soldier in these activities and taking a persistently supportive role. For example, she was a civil rights worker in the 1960s in St. Augustine, Florida, and West Point, Mississippi. She has been arrested several times for crossing the line at the nuclear test site in Mercury, Nevada, and has also been a persistent thorn in the side of the water buffaloes pushing the Lake Powell pipeline. I now turn the time over to Gail.
Well, welcome again. It's pleasing to see people here, and it's particularly pleasing to hold an event on this important topic, which has largely been hidden from public view. Over a period of 4 decades, the U.S. government conducted 100 nuclear bomb tests when the wind was blowing towards Utah. People and livestock downwind of the test were exposed to heavy doses of radiation. Although the last such test was in 1992, this is not just history. The ramifications of building and testing nuclear weapons are still with us, as you will hear today. Our topic today is the effects of radiation exposure on Native Americans in Utah. These come from uranium mining, from abandoned mines, from nuclear waste disposal and storage, as well as from testing. All of these things are part of the development and maintenance of a nuclear arsenal. We have a very strong panel to talk about this topic. Our first panelist is Tara Benally. She was born Hopi, but raised Navajo in San Juan County by a family of the Folded Arms clan, which I'll try to say, Dene Betenil. She has been field director of the Rural Utah Project since 2018. A substantial amount of her work, her recent work, which has been frequently cited on KUAR, dealt with voter registration in remote areas of the Navajo Reservation. Voter registration requires addresses, and having an address is also crucial to documenting radiation impacts. She is highly informed on conditions in the Navajo Reservation. Dr. Tommy Rock will assist Tara in her presentation. Dr. Rock is an environmental scientist with a PhD from Northern Arizona University. He has been involved in uranium research since 2006. He was a member of the Navajo EPA for 2 years, I think. Let's welcome Dr. Rock and Tara Benally.
Yate. My name is Tara Benally. I am Hopi, born for Navajo. Those are my 4 clans. I am Hopi, raised by Navajo. My family was raised by Navajo. I'm born for the Marks on the Cheek Navajo clan. The Deer Spring clan are my maternal grandparents, and my paternal grandparents are the Reed people. When I first started in this work, I had heard about uranium, and I think a lot of the awareness stemmed from the fact that I was out there among the people working back in 2013, 2016. I was building homes on the southern part of San Juan County, Utah. My first introduction with uranium was with Mary and Carrie Dan, who are the ladies out of Nevada. I saw their documentary film on FNX, the First Nations experience. And I thought that was just the saddest thing, to have something happen to 2 sisters, to have their livestock run off due to uranium, due to exploration, due to, and they were elderly ladies. Who in the world would do such a thing to these ladies? And the more I watched the documentary, the more I realized something needed to happen. And so it just so happened a couple of weeks later, I happened to come across a news article from out of New Mexico. One of the sites there in New Mexico had qualified for the Superfund. And so I'm like, okay, what is a Superfund and what does it do? So I started researching the Superfund, and I started looking at areas in my community down in southern Utah. The closest one being the Hulchita site and the Cottonwood site there just north of Bluff. And then there was a site there just outside of Monticello, Utah as well. And then the VCA site just south, east of Monument Valley. And so I started looking at these sites, and not a one of them had qualified for the Superfund. Not one of them. Hulchita, yes, there was some work done. But nothing has had happened since the 50s at these sites. Yes, that data was gathered. There's information out there on these sites, but nothing, no cleanup, nothing. And so I started talking about it, and I started talking to people about it. And that's when my mom made me aware. When I was 18 years old, I had an aunt. She was diagnosed with leukemia. She was Down syndrome. She had no way to communicate her illness, her pain. And less than a year later, we lost her. Just recently, I had an aunt who was diagnosed with cancer. 2 years ago, I had a little sister for 40 years, and we lost her to cancer as well. So knowing that and seeing that and starting and working on the southern part of San Juan County and sitting down with these families during lunch or right before I went to work on their homes and listening to them, their health issues, the quality of health services there on the southern part of San Juan County, the educational issues, the lack of it. And I started to think, well, why isn't something being done about this? So just my part in just building homes for my community members had lessened yes, it was an important thing, but there was so many more issues, and uranium was at the top of these issues where health was concerned, education was concerned. I had just met after I had lost my aunt Cornelia and my little sister Tanya, and heard about my aunt who was diagnosed with cancer again. I started interviewing community members, starting from Monument Valley, down in White Rock, and just down the road from where I live at, and down in T-Snuzbus. And their stories are very similar, where Perry So, whose father, who worked in the mines most of his life there in the T-Snuzbus area, and then also in Colorado. He had just recently passed about 5 years ago. He had finally given up to cancer. He had pulmonary fibrosis. He finally told his kids, I'm starving for air. I can't do this anymore, my kids. And sitting there interviewing Perry So, who was the second child, and talking to him and asking him, well, what more could you have done? What more he goes, well, he received his compensation, but there was so much more that needed to happen for him. There was so much, the research, we needed more answers. We needed to find out what was going on with him, why he was having to deal with this. Or Ida Yellowman, who is my clan sister, when she cries to us and tries to bring awareness to us and says, I take care of my patients, my hospice patients, home care them. They come home from these hospitals, and yet nobody's doing more for them. Why is that? What's happening? What's going on here? There should be more done for these people, for my family, my community members. I also interviewed several family friends out of Monument Valley, and they have each of the siblings. Their parents lived down by the VCA mine because their father worked down there. But they stayed up on top closer to the road with their grandparents. But on a day-to-day basis, they saw these trucks leaving VCA and that dust just blowing from them. And to this day, they wonder why they have that constant cough, that irritated throat and constant cough. And the doctors won't tell them. They don't know. Or the funding, they don't know. They need to go see a specialist. And so they just sit there and they just deal with that cough on a daily basis. These are real things. These are real people that I interviewed. My brother, Marc Mero, I sat down and interviewed his sister. Their dad worked at one of the mines also there in the Cottonwood area. She used to pack lunch for their father, and Mark's older brother and sister used to go down into the mine shafts and take a tin cup and drag it along the walls of the mine shaft to collect water and drink it. And they weren't told, they weren't cautioned. They weren't told the side effects of what was going to happen. And today those two, my brothers and my sisters, are gone. I remember my grandpa working down at the Monticello site, my mom telling me she used to see kids playing out there from the runoffs from the mine, playing in the water all day long to cool off. And just 4 months ago, I lost an aunt on my dad's side because of it. They had to move out of their house, have their whole front yard dug out because it was contaminated. They had uranium contamination. They had to have their home rebuilt, and it was just right there, just about a half a mile where the uranium site was at. I hear about people gathering data year after year after year. How much more data do we need to gather? How much more knowledge do we have to have with uranium to do something about it? What are these data telling us? What are they doing for us? What are they doing for our people? We haven't seen results yet. And we need to see results. Day in and day out, where Perry So is concerned, he prayed and went to ceremonies with his dad. Kan yet. Humana Hasabachan, Hoti, Shajab, Nachabajan, Auti. Father Sky, Mother Earth is sick. Therefore, my father's sick from it too. How do we help? How do we help my dad? You know, my grandma taught me a song way back when about the long walk, what the people went through. It's one trauma after another. Well, the whole yeti. Well, the whole yeti. Dola do ho yeta oh hey. Well, the whole yeti. Anele betrodolde. Ditchen betrodolde. Dola do ho yeta oh hey. That's a song about the long walk, what the people went through. The first two verses, they traveled through starvation. They traveled with rags on their back. And my grandma taught me, yes, it's an awful song. It's an ugly song. But because of it, draw strength from it. And I have proud family members who work day to day despite everything that they have gone through, what they're going through, the pain that they go through on a day-to-day basis because of these illnesses. And I try to make it a point, and therefore when Rural Utah Project had approached me, I said yes. Yeah, I turned them down a couple of times, but I still said yes because I saw the reasoning behind it. Something needs to happen because it's not just our loved ones. When these uranium sites are cleaned, where do they go? It goes to our neighbors to the north of us at White Mesa. And they're worried about their waters getting contaminated. They're worried about getting sick, their loved ones getting sick. So what do we do? Where do we go? What do we tell our kids? Because we're a lot of the stuff that we do today, we do for our kids in 7 generations. That's how we count, is in 7 generations. How do we make it go away? You know, it's been hard for me. It's been a real struggle, and I'm constantly thinking about what do we do next? How do we go about it? How do we resolve a lot of these issues? We had a representative come down to Mexican Water Chapter about a year ago. I had no knowledge about the uranium in southern Utah. No knowledge of it, the sickness. How do you become a representative to the people and not know about this? You know, it's heartbreaking, and I know I'm losing my family to it constantly, almost on a daily basis. I know my sister Ida Yellowman has seen family members lose family loved ones. You know, John Chapitz, when he had his town hall, he had said his mom was diagnosed with cancer. So it's out there. We all know about it. So what do we do? Where do we go now? How do we resolve these issues? Because that's the answer that I'm seeking from my people, my community members. And I'm sure that's why Dr. Tommy Rock, I invited him to come along, because he has more knowledge in this area. It's his study since 2006. So I introduced Tommy Rock to you.
Hi, good evening. Well, give a little bit of my credentials. So, I got my bachelor's degree from Arizona State Environmental Geography and Recreation Management. I got my master's degree in sustainability from Northern Arizona University, my PhD from Northern Arizona University as well. Between my master's and PhD, I was a research scientist at University of New Mexico, working on a big kidney study looking at uranium as a heavy metal in Eastern Agency, it's called, over in New Mexico, eastern portion of Navajo Nation. Did that, and when my funding ran out, I worked for my tribe, Navajo Nation Environmental Protection Agency, for 2 years dealing with public water. I work a lot with unregulated water and regulated water. When I say unregulated water, I'm talking about people that use windmill, springs, hand dug wells, hand pump wells for human consumption. That's what I'm talking about. When there's a lot of that on Navajo Nation, there's about 30% of the Navajo population that use these water sources for human consumption because there's a lack of water infrastructure on Navajo Nation. And it is an issue when it comes to uranium contamination, groundwater contamination. So a lot of stuff that I do has to look at different pathways, exposure. So a lot of stuff that I'm talking about is risk assessment. How many of you are familiar with risk assessment? All right, cool. So there's risk assessment. What about risk management? Risk communication? All right, cool. And those of you that don't know, well, I'm glad you're here, so I can teach you something new. All right. Getting my PhD working here. So, for risk assessment for Navajo Nation, looking at different pathway exposure, Navajo Nation is unique, or indigenous population is unique in this way because as an indigenous population for Navajo Nation, and particularly, this is not only associate that with Navajo Nation, but different tribe as well. We use the whole environment for medicinal, for all type of uses. So if there is a environmental contamination, we're more likely to be exposed to it from different pathway of exposure, like through drinking water, through dust, with using the plant as medicine or smoking it in ceremonial purposes. So, which makes this topic unique to us in this way. So, when I talk to US EPA or some regulatory agency, I like to talk about traditional ecological knowledge, like some of the stuff that we use to make or create or talk about policies that are culturally sensitive that can be applicable to Navajo Nation. There has been policies in the past. U.S. government has a really bad history when it comes to policy making when it comes to indigenous population. You can look at history, you can read a lot about that. So there's that. So that's the reason why we talk about traditional ecological knowledge, using some of these knowledge to create policies that can be applied to indigenous population for us to be Navajo Nation, that can be used and applied with no backlash. Some of the stuff that came up related to this topic has to do with like a couple of years ago, or 10 or so years ago, there was some work that was being done from US EPA, from Region 9, with Navajo Nation about educating the public about radiation exposure, what radiation is, alpha, beta, and gamma. And they use a goat, a cartoon. And when they did that, they sent it out to the public, and there was a backlash, and a lot of people were upset. And with all that work to to educate the public about radiation, what it is, the only thing that's used for nowadays is a fire starter. It's a pretty good fire starter, by the way. And it's collecting dust. So if we're going to create policies, it has to be led from the indigenous population or group or people that are working in that area, so that can be applied with no backlash. And also, when it comes to risk assessment, I always like to talk about holistic risk assessment, which is a term that was introduced by a researcher from the Mohawk Nation that was doing some work around environmental exposure. And I like that term, holistic risk assessment, because it looks at all these different pathways of exposure, and we can go and address that. So some of the stuff that has been done has to do a lot with water contamination, and we did some work around soil, and we did some work around plants, and slowly transitioned to traditional indigenous food. And for us, for Navajos, it has to do with sheep, because sheep is delicious, sheep is the best, and don't take my word for it, try it. So there's some being work around that, and looking at maximum contaminant level, MCL, so to figure out which tissues in the sheep has how many uranium in the tissues, and how much is too much, and what can be done about it, and how can that be addressed. Because for us, we use sheep in social gathering, family gathering, ceremonial gathering, as well, like for food and all. So we need to go and address that and figure out how to go about it to keep practicing our culture. And when it comes to the Superfund, the CERCLA law, CERCLA, the way it's written, is not applicable for Navajo Nation. The reason behind it is because the CERCLA law is based on population density, and Navajo Nation doesn't have the population density to be applied. So what US EPA did, Region 9 did, is they modified it so it can be used on Navajo Nation. So where there are communities established and where there are abandoned uranium mines, they can go and use that so they can address the uranium contamination. And there are 4 Superfund sites on Navajo Nation, but that is specifically to uranium mill sites, former uranium mill sites, and there are, like I said, 4 of them. One in Tuba City, Arizona, one near Monument Valley. I am from Monument Valley, by the way. And another one in Shiprock, and another one in Church Rock. So in this way, the Superfund law has been modified so it can be used or utilized in this way. And with the cleanup, it's slowly happening. I sit on the Diné Uranium Remediation Advisory Commission as well, so there's about 12 of us that would sit on that, and we talk about ways for this cleanup to happen, because there is policies related to uranium mill cleanup, but there is no policies related to uranium mine cleanup. And when it comes to risk communication, you probably know all about this. For those of you that are familiar with risk communication, reframing. And what US EPA did is, US EPA from Region 9 is reframe the issue of abandoned uranium mines. There's over 1,000 abandoned uranium mines on Navajo Nation. So saying 1,000 abandoned uranium mines sounds pretty bad, right? So by reframing it, they came down to, instead of saying over 1,000, it came down to 523 abandoned uranium mines. And how they did that is they grouped a bunch of abandoned uranium mines that are clustered together, and they count that as one. So it came down to 523. It's reframing the issue, so it doesn't sound so bad. But when it comes to uranium cleanup, and we're specifically focusing on Navajo Nation, however, in the West, there's about 15,000 abandoned uranium mines. And the thing is, like, looking at those responsible parties, the companies that did the mining, and a lot of them are long gone. And for Navajo Nations, we're still working on that and ways to address that. And my tribe won a big lawsuit, which they won, or we won, $1 billion to address some of the uranium mine, about half of them. And there's still no money to do the other half as well. So it's still an ongoing issue, and we're looking at ways to address that as well. So if there are 523 uranium mines that are being addressed, what's going to happen to the other mines that are not being addressed across the U.S., across the West, the 15,000 abandoned uranium mines? Who's going to clean that up? Where's the money going to come from? And unfortunately, with the Superfund laws, like Superfund laws based on taxes, so a lot of that's going to be out of our own pocket. We'll be the ones that will fork up the money to do a lot of cleanup, which sucks. Means pay more taxes. Pay more taxes sucks. So this impact not only indigenous land or public lands, and also like affects other tribes as well. And some of the stuff that I'm looking at, Bears Ears, I see a lot of abandoned uranium mines over in Bears Ears. So right now, the conversation, the stuff that I'm talking about, I'm just talking about uranium. Uranium as a heavy metal, but uranium is also has the radiation to it, alpha, beta, and gamma. How many of you are familiar with radiation? Cool. All right. And for those of you that are not familiar with it, I'll give you a really quick rundown. It's like alpha, they travel that far, but once it gets inside your body, it will do a lot of damage. That's the one that we're really interested in. That's where a lot of research goes into. Then there's beta, it'll go through some stuff. And then there's gamma radiations, like X-ray is a good example of gamma radiation. So when you look at a uranium ore, let's say this was a uranium ore, the thing that we're not discussing here at the moment is within that particular ore, there's uranium, there's radium as well, and there's also vanadium. And if we're going to have this discussion about uranium mining, it has to go even further back because, like I said, it has vanadium in it. And in the early 1900s and the late 1800s, Europe was they were going crazy with vanadium because they figured that cured a lot of stuff. So that came out this way as well. And some of the vanadium mine dates all the way back to like 1918, and it's 2020 now. Some of those particular mine where vanadium mining happened, a lot of the companies went back to those same mines and started mining uranium again. So it's over a century now, and a lot of those places are not cleaned up. So there's a lot of the things that blowing all over the place or going to the groundwater. And some of the stuff that I looked at, some of the work that I've done has to do with groundwater contamination. Groundwater can happen like in a couple hours, couple days, couple weeks, or a couple months, or a couple years. It takes time for that groundwater to show up in a public well. So it is an issue, and it costs a lot of money for that cleanup to happen. And there's whole other issues related to public water, issues related to kidney disease. I see a lot of stomach cancer, kidney cancer, and other cancers related to that. Nephrotoxin, that's what it is. And with all these combination of exposure. There's radiation exposure, uranium exposure, and there's also, when the land is disturbed, there's also other heavy metals that are exposed as well, because when the land is disturbed, the heavy metals of where that site is goes up as well, like iron, arsenic, and what have you as well. So there's all these combination of exposure that's happening. All right, my time is up. Hope you learned something.
Our third panelist is Robin Craig. And Robin Craig is the James I. Farr Presidential Endowed Professor of Law here at the S.J. Puente College of Law. She is an expert on toxic torts and an author of a textbook on this subject, Toxic and Environmental Torts. This makes her an ideal person to discuss the Radiation Exposure Compensation Act and the proposed extension to this act currently sitting on Mitch McConnell's desk. In addition, her current work on ocean looks at the incorporation of indigenous people into the marine spatial planning and fisheries management. So I turn this over to Robin Craig.
All right, well, thank you, Gail, and I'm honored to be part of this presentation. I was asked to just kind of give a little bit of an overview of the Radiation Exposure Compensation Act, RECA, and what proposed amendments are out there, and maybe a little bit about the best predictions on what might happen with it this year. So, some background, we've gotten a little bit of this already. But starting on July 16, 1945, the United States started conducting atomic weapons tests. There are, by official count, 1,054 tests, including 24 that were jointly conducted with the United Kingdom. Various geographical locations, but by far most of them occurred at the Nevada test site. The first test, however, was in New Mexico at the Trinity test site, but from then on, most of them occurred at the Nevada test site. 928, 828 of those were below ground, and 100 were above ground. So, cancer from nuclear testing, if you're a toxic torts professor, gets to be a very interesting subject. But I'm going to start with this map of fallout exposure. First of all, to emphasize that there's a lot of it, and it's very hard to live in the United States without having been exposed to fallout from nuclear testing. But also to emphasize that whatever I'm going to say about RECA, on many levels, it does not come close to compensating everyone who has suffered from the exposure. For example, some of the plumes have been tracked into Canada and to the East Coast, so nowhere near covering it. So everyone is certain that the fallout from nuclear testing increased the numbers of cancers in the United States, especially leukemia and thyroid cancers. Pinning down how many that would be is really difficult. And the Centers for Disease Control, you can go to their website today, and what they will tell you is if you were born after 1951 in the United States, you've been exposed to radiation from nuclear weapons testing fallout. For most of that, to go back to Tommy's point about risk, that does not appreciably increase our risk of getting anything, but for some people it certainly does. It's also increasingly difficult as time goes on to separate exposure from U.S. testing from exposure as a result of the cumulative nuclear weapons testing that occurred worldwide. So if you're thinking on a toxic torts perspective, that becomes difficult. But some of the more authoritative estimates of cancers in the United States, the Centers for Disease Control and the National Cancer Institute in 1997. So there were at least 11,000 excess cancer deaths in the United States as a result of nuclear testing, with a median estimate of 49,000 excess cancer deaths, going possibly as high as about 167,000 excess cancer deaths. So that's quite a range under any sort of population study. The National Research Council did its own review of those studies and came up with an estimate that there's probably 80,000 excess cancer patients as a result of nuclear testing, and about 15,000 cancer deaths in the United States from total exposure to nuclear testing fallout. So not quite comparable, because the NRC was looking at all fallout. But there's two important routes of fallout exposure, and the one that RECA tends to focus on is the direct exposure. You were there, you were a downwinder, you got the fallout coming directly and had direct exposure. But as Tommy mentioned, there's an equally and probably more important exposure route that comes from eating or ingesting fallout that's gotten into the food supply or the water supply, which tends to end up with thyroid cancer from the I-131 exposure. This is thought to be particularly problematic for people who were children in the 1950s and 1960s and drinking a lot of what turned out to be contaminated milk. So why do we have RECA in the first place? The simple answer is because lawsuits against the federal government for nuclear testing under the Federal Tort Claims Act don't work. For those of you who are not lawyers, suing the United States is not the easiest thing in the world to try and do. The United States enjoys pretty broad sovereign immunity, which means you can't sue it without its own permission. The Federal Tort Claims Act is one of the statutes that does give permission to sue the United States for liability in tort like anybody else, but it has some really broad exceptions to it, and especially in the context of nuclear testing, those exceptions ate up the cause of action. So a very important case out of Utah, brought originally in the U.S. District Court for the District of Utah, and then went up to the 10th Circuit, involved 1,200 downwinders in Utah, and what the 10th Circuit decided in 1987 was that all of their claims, tort claims against the United States, were barred by the Federal Tort Claims Act discretionary function exemption, which basically, if there's any discretion on the part of the government, you can't sue them for whatever they decided to do. So it's a very broad exemption. Right around the same time, in the 9th Circuit, which is where Nevada sits, the INRI consolidated U.S. atmospheric testing litigation was decided, and the 9th Circuit said, by the way, the Federal Tort Claims Act also bars exposure claims by military personnel. So if you're a member of the armed services, you can't sue the United States. And then after RECA, but just kind of putting the nail on the FTCA as a cause of action, the District Court of Nevada decided, by the way, the Federal Tort Claims Act also bars claims by nuclear test site employees. So you add all that together, and there's basically no way to sue the United States in tort for the nuclear testing. And so Congress came back with RECA. This is not the only time Congress has enacted a compensation statute when tort was not a viable route. We've got similar statutes for childhood vaccines, for example, but RECA also came with an apology, which is a little unusual in federal legislation. So RECA's history: the original statute was enacted in 1990. It was sponsored by Representative Doug Owens from here in Utah. became a public law on October 15th, 1990, and then was codified into the United States Code. Second big part of RECA is the Radiation Exposure Compensation Act amendments of 2000. Those amendments expanded the Downwinders covered areas. It expanded the states where you could bring a claim as a uranium miner. They added claims for uranium millers, and recognized tribal law in terms of who counted as a spouse under RECA if someone who qualified under RECA for compensation has already died, their spouse, children, and parents in that order can claim the benefit. And there was an issue of what counted as a marriage. So recognition that tribal marriage counted for RECA came in 2000. So the overall RECA geographical coverage right now is up there on this map. The yellow states are where you get the uranium mining and milling claims allowed after the expansion in 2000. The two greens are where you get the downwinder claims being allowed, and the dark green in Utah and Arizona is where those two geographic areas overlap. A little bit more focused on the downwinders. So the black box was the original proposal for what would be covered for downwinders. The yellow with the red stripes is what was allowed under the original 1990 action. And the light yellow without the red stripes is what was added in 2000 for downwinder claims. I find it interesting that Las Vegas was originally concluded and has not been included since. So, side note, but Las Vegas isn't in there. Basic compensation for downwinders is $50,000. It's not much. It's $75,000 if you were an on-site participant, and $100,000 if you were a uranium miner, miller, or transporter. So downwinders is not enough if you're suffering from any of those cancers that were mentioned. There are exposure requirements, 24 consecutive months between 1951 and 1958, or the entire period of testing in 1962 in one of the correct geographic areas. And then finally, you have to have the right kind of cancer, emphasis on leukemia, but also the bottom list, if you get any of those other cancers after 5 years, those can count as well. And it does include thyroid. So if you're in one of the covered areas and we're ingesting the thyroid cancer that you're likely to get is covered. So, latest statistics I could find on the RECA claims. What's interesting about this is it's far in excess of what Congress expected to pay. It's up over $2.3 billion at this point. And the downwinder claims are by far the largest category of claims that have been filed, coming really close to half of the money that's been paid out, even though that's the smallest individual claim by money. All right, so why act now in terms of RECA amendments? Well, RECA terminates on July 9th, 2022, if nobody does anything. So it had a time limit in it. That's coming up. That's one of the reasons why there's been interest in amending it. Right now, sitting in Congress are actually two sets of proposed amendments. So one set is the Downwinders Compensation Act of 2019. This is by far the more limited of the two. There is both a House bill and a Senate bill introduced early in 2019. What these would basically do is extend the downwinders coverage area to all of Arizona and all of Nevada. What everyone is much more interested in are the Radiation Exposure Compensation Act amendments of 2019. Again, there are companion legislation that are in place. The sponsors of Senate Bill 947 are listed there. Cory Booker being the interesting addition from New Jersey, but otherwise Idaho and New Mexico and Colorado, the primary sponsors there. The House of Representatives bill was introduced in July. Representative Lujan from New Mexico is the primary sponsor. There are a lot of co-sponsors on the House of Representatives bill, and quite interestingly, they're from all over the United States, so a lot of Eastern co-sponsors on the House bill. Both of them would increase the downwinder benefit to $150,000, so triple the benefit that would be available to downwinders. Would expand the downwinder area to almost all of Arizona, Colorado, Idaho, Montana, Nevada, New Mexico, and Utah, and would extend the time to file the claims until 2045. So it would be a considerable expansion of RECA compensation if enacted. Now, the question I was asked as we were sitting down, what do I think the chances of it being enacted are going to be? I'm not going to give you my estimate because I am hopeless at predicting what Congress will do, unless I predict nothing, and that tends to work most of the time. But there is a wonderful program out there called Scopus. It's a big data analyzer that has looked at all congressional bills. So I don't know how far they've taken it back now, but they keep going back farther in time. It's actually proven extremely accurate in predicting what congressional bills will pass at any given moment in time. And its prediction for both of these is 3% chance of passing. So not, if Scopus is to believe, and like I said, has a pretty good track record, not looking particularly good for this year. Of course, next year is a big election year, and that could change the possibilities of many, many, many things in the United States, including RECA amendment. So the other thing that's worth noting is that in October, the Western Governors Association, including Governor Herbert, wrote letters to both the House and the Senate urging passage of the second package. So the Western governors clearly want it in place. So that's what I can give you on where we are right now, and thank you very much. And again, happy to be part of this conversation.
Well, I'm sure there are many questions in the audience, and we have two speakers, one in each aisle, that you can come up and ask some questions. I thought I might start out and ask Tommy and Tara about what their views of this new RECA are and what its impact could be. Now, we've already just heard it has a 3% chance, but is that something that you see as something helpful?
Something helpful.
Yeah.
But what are the chances? 3%, according to Scopa. I don't know. It's always a slim chance. It seems like where indigenous people are concerned. It's always a slim chance, regardless. So it doesn't look very optimistic in our favor. And it usually isn't. But you know, if Congress, with the big election and everything coming up next year.
Well, with RECA, was particularly focusing on the former uranium mining workers, and a lot of that population died or passed away from cancers and all. And there's still a few of them around, but like I said, it's primarily focusing on former uranium mining workers. With that said, there is some research that's been done related to that, some of that going all the way back to the 1950s and 1960s from the Indian Health Service. But nowadays, a lot of these abandoned uranium mines have been open for a very long time, and there's hardly any studies related to the public that has been exposed to these abandoned uranium mines that have been left open. The only researchers that are doing work related to that is the University of New Mexico, and that's the birth cohort study, looking at women, infant, and babies that are being exposed. And they did see some preliminary data that they see uranium in babies in their urine, which is an issue. And some of the stuff that I've seen in the research that have been involved, I do see uranium in sheep fetuses, like that's still in the womb of the sheep. So that is being transported from the mother to the little lamb, and the same things happen with human as well, which is an issue, which is in other studies when it comes to heavy metal, like arsenic, heavy metal, lead, it shows being affected by like cognitive being affected, like not a lot of kids learning as well as they should be because of that. So we don't know what's going to happen when it comes to little kids. So some of the stuff that I've talked to you about has to do with chronic exposure, and there has been cases where there has been acute exposure. So there still needs to be a lot more work, even though it doesn't look good, but I'm still be optimistic and like, hey, he's like, hey, if David can slay Goliath, why not? Let's keep pushing forward. So.
Okay. It looks like we have a question right here.
Thanks. Not so much a question as a comment, and I'd like your reaction to it if that's okay. Been involved with Downwinders for many years and original passage of the RECA legislation. The new legislation that's before the House and Senate may be a slim chance, according to the statistics, but that's where the public comes in. And it needs to be an issue organized around. It's not simply a case of justice for those who've been exposed. There are many who have been shut out of that compensation process because of the constraints within the legislation. But even more than that, we're now in an era where we are going to be abandoning additional nuclear treaties. We've already seen the Trump administration renege on the original Iran nuclear deal, the JCPOA. We've seen the United States withdraw from the INF Treaty, the International, Intermediate Forces Treaty that was struck back in the 1980s, and to curtail the issues in Europe with nuclear weapons. We're on the brink of abandoning the Outer Space Treaty. We're also on the verge of getting out of the Nuclear Proliferation Treaty so that we can devise new generation of nuclear weapons. On top of that, we're also now looking at a new generation of nuclear power plants, and so there's lots of stir around the idea of resuming mining of uranium on the Colorado Plateau. So if this is not the year to contact your members of Congress and talk about this problem in its entirety, its totality, the cumulative impacts and the need for justice, but not just justice, but no more, then I think we will fulfill the prophecy of the statistician. So that's my piece, and I'd love to hear what you have to say about that.
Just to add to that, is like when it comes to uranium and groundwater contamination, especially in the West, and looking at the climate change models that's been predicted by the climate scientists, we're gonna be having less precipitation. So with that said, if we're having less precipitation, a lot of these groundwater contamination won't be diluted. It will actually increase the heavy metal and also the radiation in the groundwater as well. So it'll be a lot more concentrated, which will be more of an issue with, looking forward, looking to the future. So it should be an alarming to all of you, all of us, because we don't have a lot of water in the West. So it's like, I don't know how, I'll just stop there.
We have another question up here, or comment?
Yeah, I am a lot like your family that you talked about, whose father was in the uranium mining business. My father worked in the uranium mines right around the time that I was born. I'm 61, going to be 61 next month. And I have a lot of family that have passed away from cancer. And a lot of the stories that were told in my family are similar to yours, where my mother gathered the logs and the different wood supplies from the mine to build her shade house, to build her hogan. They used the water running out of the mining to wash their clothes in, to bathe in. And my father went through 3 surgeries. But what is an obstacle for my family to be able to be reimbursed or to be able to legally fight this is, isn't it odd that the health records of my father were stored in a building on the reservation that happened to burn down twice? And isn't it odd that when I look up my father, all of his children have tried to look at his work record. And Social Security, the employer, the mining company that was out there, was most likely paying under the table. And our family knows he worked all that time for years, but Social Security shows no record of that. Nor can we find the information to the companies that employed him. So how do we have, like I said, he died, he went through 3 surgeries and passed away, and his children are dying from cancer, and have a lot of the symptoms that was listed on there. How do we fight this when when documentation is hard to come by? And this my family's experience is not uncommon. This is what they did to us indigenous people, because there was a barrier in language, because we didn't know, and we were so manipulated and everything. Are there ways that we can fight this, for my family and for all those that are in the same predicament?
One comment on this. We had some people here coming with CLE, continuing law education, and it strikes me that this is an area for lawyers to get interested in. Kathy, you have something. Thanks.
Did you want to respond to any other
Does anybody
others
other comments on that?
That is a common comment. That is a common thing that a lot of families are saying in our area as well. That my grandfather, he traveled around a lot to different sites as well, and there's no paper trail. And so we don't know if, my mom and her siblings should we even try? Because we don't have any documentation to say that he did work in these areas.
What's really blatant is the stores where the records were kept. You can't say that that's just a coincidence. that most of I come from a little town called Navajo. My father's generation in my little village on the reservation, we lost all of our men. During when I was a young girl, I was born in '58. My father passed away when I was 4 or 5. During that generation, during that time period, we lost all the men in our village. Only the women were holding the households together. And that was for the whole, practically the majority of our town.
And it's the same case in our area as well. I can name uncles, fathers, grandfathers who have just passed. I mean, and just in the last few years as well, and not just within my family, but within extended families. And so most of them have not sought the compensation because they, like you said, they don't have the documentation to say that they were mine workers. They don't. The women are just there. They just go day by day, and so that's one of the reasons why I decided to get involved with the Rural Utah Project, was to get that voice out there, to figure out a way to fight this, to understand where and what we can do to make something happen for our people.
My name is Catherine Kruger. I'm a member of UCAN, Utah Campaign to Abolish Nuclear Weapons. And I just wanted to add to the gentleman who spoke about the broken treaties and how there seems to be a resurgence of building our nuclear arsenal, remodeling it, updating it. I thought maybe it's worth mentioning that this is coming to Utah. $125 billion. Each billion is 1,000 thousands. So think about that. $125 billion has been approved by the Pentagon to fund Northrop Grumman Company outside of Hill Air Force Base to remodel our silo nukes. I don't know what exactly that means in terms of where they do it, if they do it at each silo or if they truck them in or some. The details of it have not been made public, but that's a ton of money, and that could be used to more than compensate people. It's just really important to stay up with the news about these things because the changes are happening faster and faster, I would say. I don't know if any of you want to comment on that. Maybe Deb, would you like to say anything about, or anyone?
I think Bobby's ready.
Oh, it's like with a lot of stuff that I've done so far, like research that I've been involved with, looking at exposure and looking at health outcomes. Some of the cancers that I see out there, and some of the people that I've talked to, some of my friends that had cancer passed away. One just recently, one last year. She was a Army veteran. She passed away. She was a teacher. She was a mother as well. So a lot of these stories across Navajo Nation have that stories related to uranium exposure, and in some of these cases, when it comes to cancer cases, a lot of the medical professionals are not associating that cancer to uranium exposure. So this is particularly for Navajo Nation with the Indian Health Service. And I did a couple of presentations with some of the medical professionals talking about environmental exposure and uranium exposure. And the medical professionals are coming into Navajo Nation are not familiar with the history behind Navajo Nation when it comes to abandoned uranium mine, which is an issue, because I think that if they become more familiar with what has happened in the past when it comes to uranium exposure, it can help break some of these cycles. What I mean by cycle is like a person will get sick, they'll go to the IHS, they'll ship them off, or they'll send them to some professionals, and they'll get healthy again. The thing that happened is they'll go exactly to that same place where they're exposed to. If they don't stop that exposure, then a lot of these people will eventually pass away. And I've seen that over and over and over again. And a lot of these folks, a lot of these communities are in that same situation. So some of the things that I try to do is try to educate the medical professional to address that. So I think a lot of dialogue that needs to happen has to do with the medical profession from the Indian Health Service. So we can help stop a lot of these cycles, because we also need their input to address these exposure as well, because I think they'll have a stronger voice saying this is the cause, this is what happened, this is what you'll see, these are the causes, and these are the cancers that we're seeing. I think that will really, really help a lot in addressing this uranium exposure and these abandoned uranium mine issue as well.
And I'll just throw in a little from the law. As I mentioned in my presentation, RECA is a very narrow statute when you're thinking about all the different exposure routes and problems that remain. Nevertheless, there are administrative as well as statutory avenues. It's the Department of Justice that administers RECA. And so on things like acceptable evidence, there may be some administrative routes that would be available. But when you want to deal with larger issues of uranium exposure, that's going to take probably a really good election, I'm guessing. But if you want to do it legally, it's going to have to be at a congressional level.
Yes, I just wanted to make sure I understood correctly that there is no compensation under law for exposure, ongoing exposure related to contaminated soil and water or continued mining and milling. And I think there was a date that your exposure had to be before a particular date that you can remind us of. But is there any logic to not compensating for continued exposure, or any efforts to get that included?
Well, the logic for not compensating was the purpose of RECA is to provide an apology and a compensation for harms the U.S. military, in particular Department of Defense, inflicted through nuclear weapons testing. And that's why you get the date brackets that you do. It's the above ground testing that you had to be exposed to. That's why you get the date brackets on uranium mining and milling, is it's intended only to cover the mining and milling that was done for the U.S. government's purposes, and expressly not for private uranium mining for nuclear power plants, for example. So that's the logic. Whether you agree with the logic or not, whether it should be broader, is a very different and political issue, but the original logic was just to cover that period of testing.
I'm curious to hear about if there are any private organizations or groups who are doing work outside of maybe RECA to provide help or services to people who are affected by this. It's kind of sad. This is the first time hearing about a lot of this, to your point, Dr. Rock, in terms of education. And so I'm curious if there are, groups or peoples who, we can support in their efforts, who are trying to help, the people and families affected by this, any that you would recommend or that you know about in particular who are doing, good work that we can support in our own way.
There's the Hall No. There's the Black Protect the Black Hills from the Sioux Nation as well. There's the only one that I know of. Oh, and Eastern Navajo Against Uranium Mining. Those are the three grassroots organizations that I know of that address uranium mining issues and uranium exposure as well. So those are the If I hear of or know of, then I can go and pass that along to the people that are up here with as well, and they can spread that as well.
I think there's also uranium watches out there as well. I'm trying to remember the other organization's name, but I know Uranium Watch is also located out of Monticello. They have an office down there, so that's who I kind of get updates from.
This is a question for Robin Craig. Thank you very much for your very comprehensive presentation. I believe you said that anybody in the United States who was born after 1951 has been exposed to radiation. Did I get that correct? Did I hear that correctly?
You've been exposed to radiation from fallout in particular.
So what about people who were born in 1950 and 49 and 48 and so on that are still alive? Weren't they also exposed?
Pretty much. Like I said, I'm quoting the Centers for Disease Control on that one, and that's the line they draw. But definitely, if you came into the world after 1951, you've been exposed.
So I was not exposed because I was born before 1951, but I've been alive all these years and I haven't been exposed?
I would say that's
sense.
probably not the case, but like I said, I was just pulling the CDC's warning to everybody, or acknowledgement that since 1951 and that testing starting, we've all been exposed.
Okay, so if you're alive today and if you're alive today,
you've probably been exposed.
You've been exposed.
Yes.
Yeah, okay, thank you.
Hi, I'm Dr. Scott Williams. I'm a pediatrician. I'm the director of HEAL Utah, and we also work on nuclear exposure issues. I have two questions. One for Dr. Rock. I was at a meeting in New Mexico in November, and they talked about the Trinity test, and that the physicians in that community felt they saw a spike in infant mortality during the year after the Trinity test, but the government said that they looked at the data and couldn't verify that. But recently that data has become declassified, and it turns out that they weren't telling the truth, that they did find an increase, a spike in infant mortality. I'm just wondering if you're aware of any other data that supports infant mortality increases from exposure. And then for Ms. Banali, the other thing that was said at this meeting from members of the Navajo Nation is that they felt that the tribal government had not really done enough to prioritize this issue and to act on it. And I'm just curious about your impression about that comment.
I don't think it was the Navajo Nation. It was through the Utah government that I was referring to, if that's what the comment that I had made. The Navajo Nation, they're making every effort to work. Like Navajo Nation has its own EPA and is working with U.S. EPA. So there are efforts on Navajo.
As the researchers, if we're going to put a research proposal together as the researchers, having that data is really important. And when it comes to putting a proposal together, to look at a specific area to see if there's cancer clusters, it is impossible to do that because of the HIPAA laws, which makes this type of research difficult to do or put together. And there's a community that I'm working with called Sanders, Arizona. They have no uranium mining in the area, but however, back in 1979, there was a terrible accident that happened over in Church Rock, the Church Rock spill, and then the uranium mining that happened over in Church Rock was like over 20 years. They were dewatering the groundwater because the ore was beneath the water table, so they were doing that, and that was happening for over 20 years. And the study that I had done in that area that shows groundwater contamination, So one of the things that I was working on is trying to get data related to that. And I talked to the Navajo Epicenter, and they told me they do have data related to cancer, but it's a really broad data collection on the service that they provide to the communities, like, which is really, really broad. And Sander is off the reservations, like a little island. So trying to do a study in that area to look at cancer clusters, because I went to a lot of the meetings over there, present a lot of research results for that community, and people be talking about so and so have cancer, so and so is a cancer survivor. They know people that had cancer, and it is difficult. So the only thing I can think of is like I'm doing like a cross-sectional survey study in that area to get a better understanding of cancer cluster and start doing that research. But I'm sorry to say that Navajo Epicenter is as much as the good work that they're doing, but to specifically look at communities that have cancers or have abandoned uranium mine is impossible for do that to put a research proposal together to address that.
I think unless there are any, okay.
Regarding, I don't know a whole lot about the rural Utah project. I get emails about it, and I always tell myself I should look into this. I'm wondering, so how much? Oh, you can't hear me? Oh, okay. So I've heard of the rural Utah project through emails, and I haven't really checked into it, but I've been very curious about it and thinking I should check into it. And you said that, Tara, you said that you were getting involved with them?
I work for them. I've been working with Rural Utah Project for the last 2 years, and now my work has extended into the Arizona portion of the Navajo Nation.
Okay. Are you focusing in particular on health-related?
No, my work is basically just voter registration and getting addressing done for the nation. Anything that I do, like where uranium is concerned, is all side work that I do on my own.
Okay. Is that something that would fit into that project, or is that mostly just getting
Eventually,
people to vote?
I hope to get it, because, having, like I had said earlier, having worked across the southern part of the Navajo Reservation in San Juan County, sitting down with the families and learning their struggles and their daily needs, it was a lot of it, I found that it was due to lack of quality education, lack of quality health care, lack of quality doctors, and a lot of the doctors we're finding out, or professionals that are working in our hospitals or clinics, are doctors who have committed fraud or, and who had their license taken away in other states and are coming into our nation and practicing in our nation. And so having to get the people to register to vote and having them cast their ballots and educating them in the process of the whole electoral process and why it's important to them has been my job where Rural Utah Project is concerned. And so hopefully eventually I hope to get that knowledge and that education put out there.
Okay, well, thank you.
Mm-hmm.
Why don't we have one last question, and then people will be around afterwards, but I think we ought to be tying up.
I would just like to recommend another area that's been highly affected with U.S. government and uranium contamination would be the Marshallese Islands. I don't know if you ever heard of the Marshallese Islands. Yeah. But then I have a question is are there any more new uranium mine designations presently here in southwest Utah or southwest portions of the United States?
A lot of stuff that I've done specifically to Navajo Nations, I don't know about off the reservation there, but I do know that there are some new ones new uranium mining happening over in Black Hills up in South Dakota. That's the only one that I know of. If there's some more, then I am not aware of. And
The bigger problem tends to be older claims that can still be reopened if so desired. So maybe not so much new claims as old claims being resurrected.
So, I believe it was last year when the commissioners were just elected into the commission. About a month or so later after they'd been in office, one of the commissioners, which is not Navajo, had stated he was looking forward to getting one of the vanadium mines open. They were preparing to get a couple of those mines open over by LaSalle. So those are some of the things that I've been kind of tracking to see which one they're talking about reopening, getting ready to reopen and stuff. But since then, the cost of vanadium has gone down, so they have kind of just left it alone.
Well, I thank you all for coming, and I thank all of the members of our panel. And I think this was a very informative and helpful afternoon. Yeah. I thought one reason they wanted Trump wanted to get rid of this, shrink Farr's areas was for more uranium mining.